For most of our lives, when we hear the word vaccine, we think of one thing: preventing a disease. But what if that's only half the story? What if we've been looking at them with one eye closed?
Today, we are diving into a pretty radical idea, using vaccines not to stop cancer from ever starting, but to treat it after it's already there. It's a concept that completely flips the definition of a vaccine on its head. And believe me, it is quickly moving from science fiction into actual reality.
Okay, so to really wrap our heads around this, the first thing you need to know is that when we say cancer vaccine, we're actually talking about two totally different things with two very different missions.
At its core, the principle is exactly the same as any vaccine you've ever gotten. We're basically giving your immune system a most wanted poster so it knows exactly what to look for and what to attack. The big twist here? The bad guy isn't some virus from the outside, but your body's own cells that have gone rogue.
So, on one hand, we have preventative vaccines. Most of us have heard of these, like the HPV shot, which stops the cancer-causing virus dead in its tracks. But the real game changer, and what we're really digging into today, is the therapeutic vaccine. This is not about prevention. This is about treatment. It's designed to rally your immune system against a cancer that's already taken hold.
So if the idea is that simple, just teach the immune system what to attack, you've got to be asking, why isn't this a magic bullet yet? Well, the reason is that cancer is an incredibly smart enemy. It has developed some brilliant and frankly frustrating defenses to hide from our immune system. First off, cancer cells are absolute masters of disguise. Remember, they start out as our own normal cells, so to the immune system, they don't immediately scream danger or foreign invader. This camouflage makes it so much harder for our body's patrol cells to even notice that something is wrong. And get this, even if the immune system does spot the danger and sends in its elite soldiers, the T cells, tumors can throw up a kind of protective force field. They actually release molecules that suppress the immune response, basically telling those T cells, nope, nothing to see here, stand down. It shuts down the attack before it can even get going.
And the list of challenges didn't stop there. For years, researchers have faced these other huge hurdles. Like, it's really hard to find targets, these little flags called antigens, that are only on cancer cells and not healthy ones. Plus, large established tumors are like fortresses. They can easily overwhelm any immune attack. And to top it all off, the very patients who need these vaccines often have weakened immune systems that just can't mount a strong fight.
So how do you fight an enemy that can wear a disguise and shut down your attacks? For years, this was a massive problem. But then, scientists found a way to punch through cancer's defenses, not with a single weapon, but with a powerful partnership.
The first half of this team are drugs called immune checkpoint inhibitors. See, our immune system has natural brakes to keep it from accidentally attacking our healthy cells. Cancer is clever, so it learned how to stomp on those brakes to protect itself. Well, these checkpoint inhibitor drugs, they basically come in and cut the brake lines, unleashing the full, ferocious power of the immune system.
And this is where we see this brilliant 1-2 punch strategy come to life. First, the therapeutic vaccine acts like a spotter. It preps the T cells and points them right at the enemy cancer cells. Then, the checkpoint inhibitor swoops in and gives those ready and waiting T cells the final green light, unleashing them to attack that target with everything they've got.
And the results of this teamwork? They're staggering. When you use checkpoint inhibitors by themselves, they work, but maybe for only about 20% of patients. But when you combine them with a therapeutic vaccine, well, some clinical trials have seen response rates jump to 40% or even higher. We're talking about potentially doubling the number of people for whom this treatment could be a lifeline.
And it's not just us saying it. As researchers from the National Cancer Institute put it, this combination could dramatically boost effectiveness, and it does so without adding a lot of nasty side effects. It's a strategy that could open the door to better outcomes for a much, much larger group of patients.
So this incredible partnership has really set the stage for what might be the ultimate evolution in cancer treatment: vaccines that aren't one size fits all, but are instead custom built for each individual patient.
The basic idea of using the immune system to fight cancer actually goes back over 100 years. But after decades of really slow progress, the pace of innovation has just exploded. The first therapeutic vaccine approval in 2010 was a huge milestone. And now, the mRNA technology that we all became so familiar with during the pandemic, well, that has put us on the very cusp of the next giant leap forward.
So, how in the world do you build a personalized vaccine? Well, it all starts with the patient's own tumor. Scientists take a sample, they sequence its unique genetic code,
and they hunt for mutations that create these abnormal proteins called neoantigens. The best way to think about these is like tiny, unique flags that only appear on that person's cancer cells. Then, a custom mRNA vaccine is made that teaches the immune system to hunt down and destroy any cell waving that specific flag.
The results we're starting to see are, they're just astounding. In one major trial for melanoma, a personalized mRNA vaccine, combined with a checkpoint inhibitor, cut the risk of the cancer coming back or death by nearly half, almost 50%. And now there are similar, really promising trials underway for some of the toughest cancers out there, like lung and pancreatic cancer.
All of this incredible progress leads to a really profound question. It feels like we're entering a new era of medicine, an era where treatment isn't just about external drugs or radiation, but about unlocking the power that's already inside our own bodies. This personalized approach could one day mean we rely less on harsh treatments like chemotherapy, and instead we turn our own immune systems into the most precise, powerful, and personalized cancer-fighting tool humanity has ever known.